So we've discussed the options for patients who are eligible for cisplatin for treatment of metastatic bladder cancer. But what about for patients who are not eligible for cisplatin? So one option is chemotherapy with carboplatin, which is essentially a cousin of cisplatin in the same class. So patients will get carboplatin and gemcitabine. Like with cisplatin and gemcitabine, this is given 2 out of every 3 weeks. And they'll get 4 to 6 rounds of this. Again, on completion of this treatment, patients will get scans. And if it shows complete response, partial response, or stable disease, then patients will get avelumab immunotherapy for up to 2 years, similar to what we discussed with cisplatin. This was the main option for patients up until 2023. So what happened in 2023? Well, another option has gotten accelerated approval called Enfortumab Vedotin and Pembrolizumab, which we'll discuss in the next slide. Additionally, for some select patients who aren't a candidate for either of the first 2 options, we may just do single-agent pembrolizumab. Like avelumab, pembrolizumab is an immunotherapy, but targets PD-1 on the immune cells rather than PD-L1 on the tumor cells, but essentially has the same effect. Patients who get single-agent pembrolizumab typically have neuropathy or poor kidney function that would prevent them of getting either the above 2 options. So let's talk a little bit about Enfortumab Vedotin, one of the drugs in this new combination that's been approved for metastatic bladder cancer. So what Enfortumab Vedotin is an antibody drug conjugate. It's an IV treatment and targets something called Nectin-4, which is found in 90% of bladder cancers. It has an antibody against Nectin-4, but it's also linked to a chemotherapy. The chemotherapy is called MMAE, which is similar to other chemotherapy drugs we use like paclitaxel or docetaxel. Therefore, I describe it more as a targeted missile. It's actually targeted more toward the bladder cancer than your typical chemotherapy, which just kills cells. The 2 main side effects to know about this drug are rash, because Nectin-4 is also found on the skin. So patients may get a rash, it can be treated, and peripheral neuropathy because of the chemotherapy that's attached to the antibody in Enfortumab Vedotin. So what's the evidence for Enfortumab Vedotin and Pembrolizumab? Well, this is based off the EV-103 study. Patients on this regimen get 21-day cycles. They get the Enfortumab on days 1 and 8, and the Pembrolizumab, the immunotherapy, on day 1 of each 21-day cycle. On the plot on the right, it shows the responses. Anything below the dotted line is considered at least a partial response. In this study, at least 73% of patients had a partial response. And in other studies of this combination, the response rate has still been seen to be above 60. There are even a number of patients with a complete response, meaning the tumor disappeared completely on scans. Now, some of you might have heard of PD-L1 scoring that measures the immune activity of the cells, but response did not depend on PD-L1 score. Some patients with high PD-L1 responded, and some patients with low PD-L1 responded. But because this combination was so effective, it received accelerated FDA approval in 2023 and is a choice now used commonly by bladder cancer physicians to treat cisplatin-ineligible metastatic bladder cancer.